If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org. Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us today is Steve Gregg, the Executive Director of the National Association for Continence. Welcome, Steve.
Thank you, Bruce. Good to be here. Looking forward to this great conversation today.
Yeah, this is going to be a good one because we're speaking with a patient who's had experience with incontinence following prostate cancer, which is an incredibly common problem that a lot of people aren't really aware about. Now, we're going to be talking with Dr. Peter G. Hill. He's a chiropractor who practices in Weston, Massachusetts. And before we even get going, though, I do want to make sure that everybody understands that this is not a paid endorsement. We are going to be talking about some products to help manage incontinence, but this is purely Dr. Hill offering to share his experience really generously in order to help other men who find themselves in the same situation. So with that being said, I'd like to welcome Dr. Peter G. Hill. Thank you for joining us.
My pleasure. Thank you.
Excellent. Now, I understand that you are a chiropractor who's practicing out in Weston, Massachusetts, just a little bit outside of Boston. So maybe you can tell us a little bit about your background and just who you are, some of the things that make you you.
Well, first of all, I grew up in New York City.
Where in the city?
I grew up in Regal Park, Forest Hills, Queens. I used to go to the U.S. Tennis Open all the time, so I was very happy when watching Coco Gauff the other day.
That was exciting.
And I guess to explain why I became a chiropractor, my mother, who's no longer alive today, she lived to be 92 years old. But when I was younger, around 13 years of age, she had leukemia, and she was on chemotherapy for 14 years. Luckily, she didn't complain very much about being on chemo, but I felt that if I can help people naturally, that's why I became a chiropractor. And then one of my best friends, who sadly I lost to COVID about 2 years ago, he went to chiropractic school first. He said, "Peter, why don't you become a chiropractor? You'll love it." And then he moved up to Massachusetts, and he said there are good insurance laws and close to ski country. And so lo and behold, I followed him up here and opened my practice actually in the south end of Boston, where I practiced for 25 years. Then eventually I got divorced, that a lot of people do in this country, and I got tired of sitting on the Mass Pike, and I opened my practice in my home in Weston, where I've practiced for the past 13 years.
Oh, that's outstanding. So now, so you spend a lot of time skiing now while you're up there?
I can call myself a ski bum. I'm a little bit spoiled when it comes to skiing. I've skied a lot of places in the world. I've got the Icon Pass, and this year I'm going to be going to Aspen.
Oh, very nice. Very, very nice. So now that sounds like all sorts of good stuff, but tell me about this diagnosis that you got that sort of led you on the path to being on the podcast today.
Probably about 6-7 years ago, when I moved from Boston out to the suburbs, I changed my primary care doctors, and my doctor in Boston I had never examined my prostate. And then I went to my new doctor, who's a female doctor, and I told her that I've never had my prostate examined. She goes, "Well, we're going to do it." So she examined my prostate, and she goes, "I think I feel something. I'm going to send you to a urologist." So I went to the urologist, and he goes, "Yeah, I feel something. We got to do a biopsy." So I did a biopsy, which is not one of the most pleasant experiences I've ever had. They do something called 12 cores with guided ultrasound. and it came back that I had what's called Gleason 6. So it was 3 plus 3. And Gleason 3 plus 3 is, they believe in doing what's called active surveillance. So I did active surveillance for a year. Then I went back the following year, had another biopsy, and it came back as Gleason 3 plus 4, which means I had Gleason 7. When they claimed with Gleason 7 that you have to do something. So I went around and I listened to the various doctors, and probably went a little too quick from hindsight's 2020, but they talk about seeds, they talk about radiation, they talk about surgery, and there's a whole gamut of like choices, and it's very difficult. I did get my slides originally done by Mass General, then I had the slides sent to Dana-Farber, where they confirmed that it is Gleason 7 and that I need to do something. I ended up having surgery 5 years ago at Mass General Hospital. It'll be 5 years in December.
Wow. So before we even talk about your surgery, I'm wondering, can you tell us a little bit about your sort of emotional state? How were you able to handle all of, well, the diagnosis and the uncertainty and all of the different sorts of approaches that they were talking about? How did you manage to go through that?
Not well. It's overwhelming. It's confusing because you know nothing about it. And there are all these different choices, high frequency ultrasound. I think there's something, a gold. There's so many different choices. Knowing what's right for you is I think one of the most difficult things that when I look online, a lot of people also have a hard time with. There's, should you do robotic? Should you do open surgery, which is what I had, or these other choices? And it's almost like you're taking a dart and you're throwing it and seeing where it lands. I'm not sure I did the right choice. I'm not sure others make the right choice. When people do radiation, they end up sometimes having to take Lupon, which I understand has tremendous side effects. I don't have to take anything subsequent. My PSA has remained low. The funny thing about my prostate cancer diagnosis is that my PSA was normal. My PSA was 2.2. My ultrasound was also diagnosed as normal, but my slides were diagnosed as abnormal. So to this day, I'm not 100% sure I really needed the surgery. If I could have done active surveillance longer, it's very confusing. And I honest to God, I don't know the right answer for anybody.
So, Dr. Hill, you're in a place that has really outstanding medical personnel.
Yes.
To be honest, one hypothesized that if I have cancer, those would be the places that would provide the best care possible. Did they help you understand sort of all the options, or are they just so knowledgeable that it's hard to explain all of the ramifications?
As far as the explanations, I was basically said, I was recommended a surgeon, that he's the top, and I went to him, and he said, well, you should speak to the radiologist and the oncologist, and it's like the fog of war. You're sort of like overwhelmed, and here I am, someone with a lot of medical knowledge, and I understand a lot of things, but even though having all this medical knowledge, it's still the fog of war.
It must be very difficult. We have heard in other places the tremendous need for what we call translation.
Mm-hmm.
So Dr. X says this, and then people go, but what does that mean?
I did speak to the Prostate Cancer Foundation, and they had recommended, I think, my slides be sent to Atlanta. I think it was Atlanta. And unfortunately, to this one doctor, I didn't do it, which I regret that I didn't do it. I think you have to pursue a lot of options. I have a patient that was diagnosed recently, about a year or so ago, with prostate cancer. And he found this doctor in Florida who did this new procedure, which basically allows him to not have any of the side effects that I have, that I had initially, and I still have some, the sexual dysfunction and the leakage issues. So he found a guy in Florida who does this new procedure. I think it's using ultrasound, there's just so many options. I mean, if I had to do it all over again, I'd probably go to this doctor in Florida and try that because, it's really after you have surgery or after you have like the radiation, it's life altering. Like I had no idea, to be honest with you, that you wouldn't ejaculate anymore. And ejaculating is one of the pleasures of having sex. It's really a life change. I'm lucky I have a partner that's very understanding and was understanding with the journey I went through after the surgery and was very patient. But it's in my opinion, taking your prostate out, taking out almost any organ is life changing.
So when you were discussing your options or discussing the surgery with your physicians, it sounds like they didn't really give you a sense of what some of those after effects might be. Is that fair to say?
They probably mention it, but they don't say, this will really change your life. Let me go through what's going to really happen. Let me explain step by step what happens afterwards, what you can expect to happen. I mean, it's there are five people in the office. They call you in. He tells you, what's going on, and it's like a 7-minute conversation. It's almost like being in a car accident. You're like, what happened? There's not much prep time. I mean, I look at my mother's journey and all the chemotherapy and all the experimental therapy. I mean, with my mother, we had to wear masks. She couldn't get her back wet for 5 years. She had an experimental immunotherapy. They talked about whether she had a bone marrow. My father rejected it back then because it was too new. But you're caught in the moment and you have to make a decision. And you don't know what to do. You hear the cancer word. And even though I've read plenty of stuff about active surveillance, when it's your body, you're like, what should you do?
So you decided to have surgery.
Yes.
And would you say that would the doctors categorize what you had as a successful procedure then?
Yes, I get checked every 6 months. I get my PSA checked every 6 months. And I guess just as long as it stays negligible, then it's considered that you're doing very well.
Well, that's good to hear, but sounds like afterwards you started to see some side effects, or not side effects, but some after effects that were unexpected then. So can you tell us a little bit about what you experienced after the surgery was finished and you started the healing process?
So the two aspects that I think are the most challenging afterwards is that initially afterwards you can't have an erection, and that's very frustrating at first. And I can go through the whole process what I did to finally get that, which a lot of people don't even realize what you have to do. And the second thing is leakage. At the beginning, I leaked an awful lot. Today, I sometimes what's called dribble, and I usually when I get the dribbling, it can be after passing gas, after if my bladder is full and not realizing it, or I have to move my bowels, there might be leakage. If you cough, if you laugh, I think they call it stress incontinence. It happens less and less today, but I still have it. And they tell you to do Kegels. I went for physical therapy and they got tested and all this other stuff. But even to this day, I'll occasionally dribble. And it's just really annoying. At the beginning it was more, and it would really like annoy me when it would happen because it would just be spontaneous that it would just more than sometimes dribble initially after the surgery. It's gotten better, but it's not 100% gone, that occasionally I'll still dribble.
You said that initially you had more significant leakage. About how long did that last for you?
Not 100% sure. I used, depends, and I wore male diapers for a long time till I discovered the Comfortex underpants, male underpants, which were, in my opinion, they're like a godsend because I couldn't stand the using the male diapers and the male pads with different stages. And I'd go on vacation, I'd bring like 20 pads with me or 30 pads with me in my suitcase. So it was sometimes it was pretty significant at the beginning, and it was very, very annoying. And they go, "Oh, do your Kegels." But some people are lucky; they get dry right away, and other people have what I have, continued dribbling. You'd have to, like I remember when I first, recently after my surgery, I would have to, like, I went out to dinner one night with my friends, and it's about a 25-minute drive. On the way to have dinner, I stopped at 3 different restaurants to go to the bathroom. It was difficult. I mean, right after the surgery, you have the catheter. I went to dinner with my girlfriend holding my catheter to a restaurant in pajamas. I also initially they tell you to walk. It was very difficult initially after the surgery to walk, and initially after the surgery, if you coughed, it was like someone took a knife and stabbed you. It was very, very painful for the first maybe week or two. And, I just kept pushing myself to walk and walk and walk and walk further initially after the surgery.
Yeah, you touched on a couple of things that I wanted to ask you about. But I mean, the first thing is that yeah, you're talking about how initially you found yourself leaking, really considerably or with a lot of frequency. And for men who are unfamiliar with what happens after prostate surgery is that the overwhelming majority, more than 9 out of 10 men will experience leakage, and there's just nothing you can do about it. So everybody who is having prostate surgery or considering prostate surgery really needs to understand that they absolutely will have incontinence following surgery. The difference is that for most men, it tends to resolve itself in a few months, 6 months up to a year. But there is a non-negligible percentage of men who still have incontinence issues that persist, well afterwards. You also mentioned that one of the other effects that you experienced was sexual dysfunction. And that's another thing that's not really spoken about a lot when it comes to prostate surgery. So maybe you could tell us a little bit about your experiences there as well.
As I said, initially, right afterwards, it's like impossible to get an erection. It's really, really frustrating. And I tried the pump, I tried Viagra. And so I got really frustrated. And a few weeks after, I went to the doctor, and he said, "Well, let's try this gel." And he took the tip of my penis and a plunger, like a needle plunger, and he put some gel into the tip of my penis. Well, I hate to tell you, I've never experienced pain like this in my entire life. I literally passed out from the pain in his office. So then I finally, he suggested I go to this special urology doctor that deals with sexual dysfunction. So I went to this guy, and he said to me, there are 2 options, but you had this reaction to that gel, which is basically a form of something called trimix, which I couldn't get because he said you'd have the same issue, but there was something else called bimix. So we tried the bimix in the office. They gave me a syringe to give myself an injection into the penis, which is probably one of the most difficult things I've ever done in my life. And it did work, though. I was able to get an erection. So for about a year, I gave myself, before having intercourse with my girlfriend, I gave myself injections with Bimix. 90% of the time, it worked. However, I hated doing it every single time because it's one of the scariest thing ever is to inject your penis. But not having to have an erection, I didn't want that either. So I was willing to do it. And so I did it for about a year. And studies show that the earlier you start either trimix or bimix, if you can tolerate the trimix, the earlier that your function will come back. So I did it for about a year. And now all I do is take Viagra on weekends. As of today, I'm able to get an erection, but obviously after prostate surgery, you can no longer ejaculate, but you are actually able to have intercourse.
That's really very interesting, and I mean, I think every step of the way it sounds challenging. I mean, just for a lot of men, even discussing with a physician the fact that they are experiencing sexual dysfunction is challenging. I know that you've been talking about how you're a very open person who's very comfortable discussing what other people might find uncomfortable. But I would imagine that even for you, it might have been difficult. Is that fair to say, or are you okay talking about that even?
I was okay talking about that too. I go skiing with this guy, a friend of mine, and he goes, I've never met somebody who's more open and willing to discuss than you. That you can talk about anything, and I can. And I told you I lost my best friend in February of 21 from COVID, and he was my best friend from first grade from Regal Park, Forest Hills, and we literally spoke 4 or 5 times a day, and nothing was off limits. There was nothing we couldn't discuss. And sometimes I maybe go too far, but I'm basically an open book.
Well, I think that that's a lesson that the people who are a little more reticent can take away from this is that, look, here's somebody, and you can see that he's alive and well and comfortable talking about it, and it's only changed your life for the better. So I'm glad to hear that, and I hope that people take a little leaf from this book and decide that, you know what, I can talk about it too. So I do appreciate that. That means a lot.
Dr. Hill, as you were talking to physicians about your prostate condition,
Yes.
surgery and surgery options, did any of them provide any kind of information about the subsequent consequences that you talked about? Right. So, did anybody ever say there's a chance you will, or more emphatically, you will for sure leak, or there's a good chance there are these kind of symptoms for sexual dysfunction? Did anybody talk about that, or did they just focus on you have cancer and we need to correct that?
They may have given me a handout to read. They didn't really concentrate on what's happening afterwards.
Were you still trying to figure out the cancer treatment?
I was trying to figure out the cancer and treatment, whether I really needed surgery or not. It didn't really concentrate on the after effects. It was really concentrating on, like, do I have to have surgery? Are there other options? And I mean, I sort of rushed it more than for a stupid reason. It was like I was diagnosed, I think, in October, and I had used up my deductible, and so I thought, well, now I wouldn't have to pay another $2,500 deductible if I got it before the end of the year, which was a stupid reason. So I sort of, ran into the surgery just because of a deductible, which is, in my opinion, hindsight is you can shoot yourself. That maybe I should have taken more time with the decision and evaluated some more, but I didn't.
Well, I think that maybe what you're saying is also a lesson that some of the physicians who are listening to this podcast can take away as well, because we do know that a good number of our listeners are also on the healthcare practitioner side of things, and that if they make sure to have these conversations in a way that is clear to the patient that these are the sorts of things that they are likely to experience, may experience, can expect to experience, and to help them come up with approaches to manage it when it happens so that things aren't a surprise and things aren't a disappointment all of a sudden in the moment. So you found yourself trying to manage. So it sounds like you were trying to do some pelvic floor exercises and use absorbent products, but you weren't particularly satisfied with those results. So what did you do then when you were finding that it just wasn't helping you manage the way that you wanted to?
I want to just talk one thing. One of the things I had was what's called nerve-sparing surgery, which most people try and have done. Is they try and, in the old days, they would just cut the nerves and then you really had incontinence. But now they do what's called nerve-sparing to hopefully get the nerves to regenerate or to heal. So what I did is I did a Google search. I was very frustrated. One, I thought it was environmentally not great that all these pads are going into the waste stream. And so I did a Google search and I came across the Comfortex male underpants and I ordered some. I was very happy with it. And then I emailed them and I said, if you want, I'd be happy to do a video for you. And I did a video for them. They go, how much money do you want? Because we don't have that much money. I said, I don't want anything. I said, I'm doing this because I want to help other guys know about it. I said, I don't need any money. I have enough money. I don't need your money. I just want to help people.
That's really generous of spirit, and we appreciate it. And even more importantly, I think that a lot of the men who are out there listening will appreciate the fact that you're willing to do something that a lot of people are really just uncomfortable with, which is talking about this stuff. I mean, do you find that it sounds like you're pretty comfortable discussing this. Did you have to overcome sort of concerns about embarrassment or anything? Or are you just one of those rare people who's happy to discuss things that other people aren't always that happy to discuss?
I'll go back and talk about my mom. So my mother, who I was very embarrassed often, my mother would like meet somebody on the subway, and the next thing they'd be over for lunch. I'd come home from lunch and there'd be like four teachers over from my school and I'd be hiding. So I sort of got my mother's disease, is that I am open, friendly. I'm as friendly with like the people, the baggers at the supermarket. Since coming to Massachusetts in 1986, I've met with every single governor in office except for Mitt Romney, though I met him afterwards. And I have not met with the new governor, though I've been trying to meet with the new governor, Maura Healey. So I am I'm sometimes maybe too much of an open book. I don't mind sharing anything. I've always been that way. Like when I was in chiropractic school, I would lead discussions. I have two different Facebook pages. One is for divorce. I told you, divorced and separated parents of Massachusetts, and another is Weston Mass Daily News. And because we lost our newspaper in town, so I'm not afraid to talk to people, be open, tell them about my issues, and I'm not ashamed at all. I mean, things happen to people. I think like when Katie Couric's husband lost from colon cancer, she became a spokesperson for it, and other people have done things. So I feel that people need to be educated, and there's no reason. I mean, things happen to us all, and I'm not afraid to discuss what's happened to me.
Well, that's really to our benefit and to the entire audience's benefit. One of the things that we like to say at the National Association for Continence is that there's no shame in being human. And that really sounds like it's exactly what you're advocating, is that these are real issues that happen to real people all the time. And the best thing to do about them is to talk about them. And I understand. So you became a really big fan of Confitex reusable leak-proof underwear for men. So a lot of people probably haven't even heard the name Confitex. Maybe you could tell us a little bit about what these products are and what appeals to you about them.
They're wonderful. They're basically underpants with, I guess, a special liner that's absorbent. I mean, I'm a chiropractor. I work on patients during the day. So if by chance, and it doesn't happen very often, that I do dribble, they don't smell. At the end of the day, I do like everybody else does. I put them in the laundry. I wash them, I dry them, and I reuse them. They're just they're very convenient, and they're simple. They look like normal underpants, and they're just very easy to use. And it's so much better than adult diapers that you throw away and go into the waste stream. And I never feel wet. They just work very well. I can't tell you. I'm 100% happy with them. It's like the best thing I've found, and I recommend anybody. And now I understand they have new ones if you leak a lot that are even more absorbent. Again, they look like regular underpants. So it's, you can take your pants off in front of somebody. They would have no idea that you're wearing special underpants.
If I were somebody who's going through similar sorts of issues, how many pairs do you think that a typical person might need? Or how many pairs do you find that you use?
I probably have like 24, but I mean, keep them in my drawer, and I just pull it out and put it on and put it in the wash. I mean, I have 24 just because if I go on vacation for 10 days, I want to have a little extra on vacation in case. But other than that, I probably just use like 4 or 5 or 6 a week. I mean, I use one a day, so it doesn't matter. I just pull them out of the drawer.
And I suppose one of the added benefits, you mentioned how that it's a better choice from an environmental perspective because you're not putting all this trash into the waste stream. But I would guess that not having to go shopping for products all the time or having to have them reordered all the time has got to be a nice little plus also, just from a convenience perspective.
It's convenient. I mean, they're not inexpensive, the underpants, but in the long run, in my opinion, they're less expensive than buying pads. I mean, they're not cheap. They're not inexpensive like if you go to like Target or anything like that. They're more expensive, but I think in the long run they're less expensive.
That's an interesting point. That one of the things that we talk about a lot when we talk about incontinence products and products to help manage the sort of leakage that you're talking about is that inexpensive may be in the short term helpful because it's better on the budget, but if it doesn't deliver the sort of management that you're looking for, if you stay wet, you stay uncomfortable, then you're really not saving anything, are you? So yeah, Comfortex.com is the place where you can see a full range of the products that they have available to help manage incontinence, including the reusable men's underwear that you found so effective, but also other products for men, products for women as well. So it's a really good resource. They are a trusted partner for the National Association for Continence, and we only partner with companies who we believe really do offer quality products, great value, and really effective, meaningful management solutions for patients with incontinence. So we certainly recommend that people who are interested do go check them out online. That's CON as in Nancy, FITEX.com.
And I think it's great that you said it. They both have men and women, and they now have this one for people who leak a lot, which I think is also great that they have that where it's not just for like the dribblers, but also for people who have a little bit larger leakage issues.
Yeah, that's important. Finding the right product is more than just a matter of finding something that feels comfortable or that fits properly or is hard to notice when it's under clothing, but also something that actually addresses the level of leakage that you have. For people with very moderate light episodes, it's going to make a big difference than people who need something that's a lot more robust. So now, before we go, Dr. Hill, I'm wondering if you could share if there's just any one simple tip, bit of advice, a little bit of wisdom to help people who are interested in living a life without leaks that you might want to share with us.
Don't be afraid to talk about it. And having some leakage is not fun, but you just got to roll with the punches.
Excellent. And that is good advice indeed. I want to thank you for joining us. We really appreciate you sharing your time, sharing your story, and most of all, your real open, honest discussion that really can help other men who are either in your current situation or who are looking at potentially having prostate surgery to better prepare for what might be down the road. So thank you for joining us.
Thank you very much. Have a great day.
Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.